About 7 or 8 years ago, I decided to change my path in healthcare. And I decided that what I really wanted to do was to hunt for healthcare organizations that were true high performers. And the definition for that are organizations that consistently deliver better health outcomes and or much lower cost than conventional approaches, particularly in high-value niches. These are both organizations that are interested in clinical risk and financial risk, which are the two kinds of risks that characterize healthcare. And so I sent out a call in various ways and said that I was interested in talking to really innovative organizations. And I will tell you that now I get 1 to 2 calls a day from organizations that want to tell me how wonderful they are, which usually they're not. But they're remarkable. There is an explosion in healthcare innovation. And the question is really whether the organizations are distinctly different and impactful or they're not. And they break out in one fashion into 2 kinds of organizations. There are organizations where the founders have taken a particular healthcare problem and that they have a lot of expertise on, and they have deconstructed that problem and come up with a solution that is entirely different than the conventional one. And then the other are organizations that have taken the conventional solution and they've turned a screw that's just right and made it different in some way, and everything gets better as a result. It's really a remarkable process, and this is what I'd like to really talk about. So the theme that I wanted to talk about here is the big question: how do we get these true high performers to the healthcare marketplace in a way that substantively changes how American healthcare works? How do we do that? Because right now we've got a lot of innovation, we've got a healthy response, but the response that we've got is really a very, very small part of American total healthcare business. And so how do we break through the relationship that the brokers have with the employers, the relationship that the brokers have with the health plans, all of which is designed to push at American consumers the most mediocre and generally lousy healthcare that currently exists today. Now, at a meeting like this, I typically don't bother to show the slides on the state of American healthcare. Everybody knows what it is, but it goes without saying, we have the most expensive healthcare in the world by double, which means that we have the lowest value healthcare, and we have really extremely mediocre health outcomes, and very, very poor outcomes for some sectors of the society. It's not only a national embarrassment, it is the single biggest threat to the national economic security. So how do we beat that? And keeping in mind that we have players, we have enormously powerful and enormously wealthy organizations that run healthcare in America. Here we're talking about the Uniteds, the Cignas, and the Pfizers, and the HCAs of the world. Keep in mind that they control Congress. Every bit of policy that occurs in Congress or in a state legislature goes through these people first, goes through the lobbyists first, and they get their way because in our system of government, the legislators and congressmen have their arms wide open to bribes. which in the form of lobbying dollars. So there is no path forward that I understand in the policy arena. The only way that we're going to get meaningful change in American healthcare is in the marketplace. And that's what we're here to talk about today. So I did this definition. I have found genuinely remarkable companies in all of these areas of healthcare. I'm interested in places where the money is. I'm not interested in wellness. You know, wellness is great, but it's a little like kissing your sister. There's just not a lot of activity that's fun there. I'm interested in specialty pharma. I'm interested in musculoskeletal care. I'm interested in chronic disease management, where 75% of the money is. I'm interested in large claims resolution, where people are looking at $25 million claims. I'm interested in places where a significant impact on total healthcare spend and quality can take place. And they're in these areas. I'm very interested as a core function in what I'm going to call advanced primary care. That's become a common term. I would differentiate this for you as different than direct primary care. Many direct primary care organizations are very well intentioned and they're up and comers, but they are largely concierge practices that don't have any data on what they're doing. They've not yet invested the dollars that it takes to have outcomes data and monitoring data so that they can use that to improve their practices. The advanced primary care organizations are moving toward using the platform of primary care as a base to manage clinical and financial risk wherever it exists throughout the continuum, and in many ways through partnerships with these very advanced specialty services that I'm going to talk about. So here are the clinical areas: chronic disease management, MSK, ambulatory surgeries, allergy management, maternity management, high performance networks, high acuity mental health, and you can see the other ones. These are areas where the money is immense, and we really need to pay attention. There is a sociology associated. I can move away from this lectern. There's a sociology associated with the people who found these high performance companies. If you put them into a room, they all look alike, and you can see that. You could see that last night at the social. This is a meeting of high performers. This is a meeting of innovators, and to describe them, they're all passionate and mission driven. They're all data and evidence driven. They all have very high subject matter expertise in their niche, and they have deconstructed some problem and then come up with a solution that's entirely different than the conventional one out there in the marketplace. And they've become very intimate with the mechanics of that, and then they tinker with it over time. And they're generally so confident in their ability to get a better result that they're invariably willing to put their fees at risk against the performance targets they claim they can achieve. I could see it over and over and over again. If I've found any flaw in them as a group, it's that if you put them in a room and you say, who's doing the most important work in the room? They all raise their hand. That's a pretty forgivable sin. When I get a call from an organization that wants me to pay attention to them, I ask them a series of questions, and they usually fold somewhere within the question set. It's taken me a number of years to put this set together, which shows that I'm pretty slow. But let's go through them. So if you're pitching me, I want to know, can you show me long-term data, longitudinal data that demonstrates that you consistently get better health outcomes and or lower costs? And I'd really like to see the arithmetic. And that's all it is. It's arithmetic. It's not math. It's just arithmetic. Can you show me client testimonials, people who will say nice things about you after you've worked with them for a while? Do you have any third-party validation of your performance claims from someone like the Validation Institute? I'm a big fan of the Validation Institute, which is led by Vidar Jorgensen over here, who I am deeply indebted to for where I've gotten to in my career. And he's been a model for me. And he's sitting right there. In case you'd like to seek him out, just pester him after the talk. Is it scalable? How does it scale? It's really great that you can do this in Oklahoma, but I need this done in Cheyenne, Wyoming, and Providence, Rhode Island, and I need to get the same results. Can you do that? Is it sticky or effective over time? It's really great that you get great results after 3 months. Are you still getting great results after 3 years? And can you show me the data? How does it integrate with the existing healthcare management ecosystem? If it doesn't integrate, if it doesn't work with the EHR, if it doesn't work with the other systems that you've got, it's a non-starter. You can't have a separate standalone system. It's a really important issue. And finally, and most importantly, are you willing to put your money where your mouth is? Are you willing to guarantee some level of performance? So for example, there's a musculoskeletal care company that I think is arguably the best in the country, maybe the best in the world, called Integrated Musculoskeletal Care out of Tallahassee, Florida. They will financially guarantee a 25% reduction in musculoskeletal spend on the patients they touch, which translates to a guaranteed 4 to 6% reduction in total healthcare spend. But what you're really looking at is an 8 to 12% reduction in total healthcare spend, because they're actually guaranteeing half of what they know they can accomplish. And so if you think about an 8 to 12% reduction, a 10% reduction, that's a big number. That's a really big number in healthcare. It's huge. I want to give you some examples of this, of what I'm talking about, the things that I run across. I get interested when I have a conversation with an organization, and so I begin to dig in, and I read everything I can about what they're doing. I think about it, and then it'll dawn on me during the day that what they're doing is really powerful and it can work. And that happens about 1 in 30 cases. So here's an example. So there is an organization out of Connecticut that has built a national network of specialty providers that'll all see patients virtually. And the strength of what they're doing is based on the fact that the specialists don't have a dog in the fight. They're not going to make money by doing things to the patient. They're there to just evaluate the patient. So the primary care docs are encouraged to refer to them first, and then they watch the percentage of virtual specialty visits that are followed by a face-to-face specialty visit. And that number drops by about 23%, an enormous number, which drops total healthcare spend, by the way, by about 20%. It's a big bang, very, very powerful. There's another company that is a TPA for surgical bundles and networks. It was just acquired by Optum. I'll get into that in a minute. But what they did was they began to build bundles. They've got over 100 bundles now, and then they began to build networks of ASCs based on the healthcare outcomes of the surgeons who worked there. and they looked for surgeons who were getting good results, but who had low complication rates. So the arithmetic of it was that they began to come in at 35 to 50% below the hospital pricing within the markets that they existed. And they also were coming in better than the ASCs that were not affiliated with them in their markets, because they were getting lower cost episodes of care. They were acquired by Optum through an organization that they have that is actually value focused. And when I was introduced to them, I said to the CEO of the organization that bought them, I said, I don't mean to be adversarial or anything, but how exactly does it work that you provide better value care, lower cost care with better outcomes into the market? And so Optum makes less money, which means that United makes less money. How do they allow you to exist? And she said, oh, we're the example for them. They know that they've got to begin to get into value, and so we're it. And I thought, well, that's an acceptable answer. The market is actually beginning to change. The third company I want to talk about is out of Cincinnati, and they have developed an AI-driven tool that guides physician prescribing for the major chronic diseases. So what I need to say about that is there are a lot of organizations that are in the chronic disease management space. Almost all of them rely primarily on coaching. And the underlying principle here is that the patients are told the right things to do, but they just can't follow instructions, or they won't follow instructions. And so it's really sort of the patient's fault, but the coach will help us get beyond that. This approach is different. It says the real problem is complexity. So here we're talking about diseases like hypertension, high cholesterol, diabetes, chronic kidney disease, heart failure. This group of, I think, 14 conditions eat up about 3/4 of total healthcare spend between the conditions themselves and the downstream impacts that they have in terms of heart attack, stroke, and so on. To properly manage these patients, a doctor has to be juggling 60 to 70 different vectors all at the same time, different variables all at the same time. It's an overwhelmingly complex task that is beyond the capability of almost any human, but a machine can do it. So to give you an example of the power of this, let's look at hypertension. Hypertension is one of the most important conditions because it's the substrate of all of the other cardiometabolic conditions. And in the US, 44% of Americans who have high blood pressure have it under control. Control is the metric that matters here. Control means that if you do a test on a patient who has a particular condition, that their metrics are going to be within acceptable limits. So 56% of Americans who have high blood pressure are out of control. This tool was piloted with 2 large primary care groups, one in Dayton, Ohio, one in Pittsburgh, and both groups got their control levels for hypertension to 94%. It is a breathtaking advance. And so you're talking about doing this one thing, changing how we attack this one problem. You can get somewhere between 17 and 25% reduction in total healthcare spend. Massive. That's how exciting this is. Here's a slide that Vidar actually encouraged me to put together that looks at different areas of opportunity and the percent of total healthcare spend that they represent, and then the amount of impact that is really possible within each niche, and then what that translates to into the percentage of savings and the dollar savings against total healthcare spend. And what the math shows in this is a very conservative analysis. What the math shows is that, somewhere easily around 30% of the healthcare dollar can go away with way better health outcomes. I actually think, based on a lot of experience over the last several years, that we're paying about 55% too much, and this is not pie in the sky. This is really achievable. These numbers are not based on conjecture. They're based on what vendors in each of these spaces are willing to guarantee on their performance. When you're thinking about these approaches and getting them into employers, self-funded employers, but not just self-funded employers, you're also thinking about anybody who is at clinical and financial risk. You're thinking about captives. You're thinking about stop-loss carriers. You're thinking about primary care clinic groups. You're thinking about TPAs. All of these groups are interested. Medicare Advantage plans and managed Medicaid plans. All of these organizations are carrying the risk, and they succeed by managing that risk more effectively than they're doing currently. So it's real important to think about how much friction each one is going to create. So for example, reference-based pricing is a very effective tool, but it's a blunt instrument and it creates a lot of friction. And it may not be worth it to an organization to use that approach. It may be worth it to use other approaches that are much more subtle and produce a lot less friction. Now, here's where it gets interesting. And this didn't occur to me until, 2 or 3 years ago. What would happen if you pulled together these very high-performing organizations? Each of these organizations is producing 10 to 20% reduction in total healthcare spend. And you were to put them together under a single organizational or contractual umbrella, and so that it allowed you to go to an employer or a health plan and say, if you work with us, we will guarantee pick a number, 25% reduction in total spend compared to last year, with improvements in the following health metrics. That's a very doable proposition, and I'm in discussions with several organizations to build that right now, using the existing organizations that we've found that are true high performers. It's a very exciting prospect. And if we can pull it off, there is no question that it would have a very significant impact on the market. You're talking about organizations that are capable of undercutting the pricing of the existing healthcare system very dramatically. It would upend the entire system. I just said this. There are all kinds of different risk carriers that are in the position to go after this. A meaningful requirement for change is to get the brokers most particularly the brokers and the employee benefit managers at the employer companies to think differently. And we have to recognize that the world is not like we would like it to be. The world is like it is. And so what we have to do is we have to literally make them an offer they can't refuse. Walking into an organization and say, I can produce a 3% reduction in your total spend is just not all that attractive. These people are wedded The HR and benefits people are wedded to their brokers, who are wedded to their health plans that they're representing. And a lot of times, terrific vendors are coming in and getting blown off because they just don't want to be bothered with the disruption. So you have to make them an offer that is so powerful that if the benefits manager turns it down and the CFO finds out about it, she'll lose her job. It has to be that strong. Now, we're getting close to that. The pandemic has brought us very, very close to that. In the pandemic, 1 in 5 healthcare workers has quit their job in the last 18 months. And to replace those workers, the providers have had to pay those workers more, and they've had to go back and pay the people who didn't leave more to keep them from straying. So in addition to the 3 times general inflation rate that American purchasers have suffered over the last 30 years, now we've got a new expense that's different, and we're going to add that on top. And I think that'll probably cause a lot of employers to stop providing coverage because they're afraid it'll just kill their businesses. But it will also generate interest in finding solutions that are genuinely better and more affordable. So we need to be thinking about that opportunity. Think about the fact, for example, the state of Connecticut, the state employee health plan in Connecticut, 2 years ago decided that this is 150,000 lives, that they would no longer send their surgeries out. They would identify the hospitals that got the best performance, the hospitals and the ambulatory surgical centers, and they would develop bundles, and they would only use bundles to pay for their surgeries. That is a major shift. This is a big organization doing something that is dramatically different. That's an important move. And there's a lot of that going on now. I have been working for the state of New Jersey employee health plan, which is 822,000 lives. They're headed in a similar direction. We can't say enough about how important this is to encourage particularly public organizations to move in this direction. This is a plug. I lost my mind a few years ago, and I started a listserv that's focused on healthcare value and high performance. It now has more than 1,000 healthcare professionals on it. Most of them are benefits managers, health benefits advisors, or innovative vendors. There's the odd doctor and lawyer on there. It is quite a menagerie of very thoughtful, very exciting people in healthcare. I'd urge you to take a look at it, and if you're interested, drop me a note, and I'll sign you up. If you decide that you don't like it and it's clogging up your inbox, you need to brace yourself. Then drop me a note, and I'll take you off. It's no problem. It's free. So here's the summary. There are a lot of high value providers out there. They're not typically in conventional networks. This is a room full of them. Much better quality is available at greatly reduced cost. We know that. Value purchasing is accelerating. It's getting traction in the marketplace, and more purchasers are systematically seeking it. I had a call from a client the other day who said we had a prospect call us and say, the only way we'll work with you is if you give us a risk-based arrangement. That's a big advance, a huge step forward. The more that begins to happen, the more things change for the positive. And demanding excellence and value is the best way to drive positive change. Absolutely. That's everything I know. Thank you very much for your patience.